Okay, guys, so someone asked me this question in my comment section under another video, but it was a great question and something that I want to address because this principle that I'm about to teach you, you need to keep it. Okay, it's very important because there are lots of questions like this that you may come across in your academic career. So here's the question. A pregnant woman with gestational diabetes, 32 weeks gestation, reports feeling shaky and lightheaded. What is the nurse's priority action? Administer insulin to stabilize her glucose levels, provide small carb snack, notify healthcare provider, or assess serum glucose levels. Gestational diabetes and lightheaded and shaky. What's going on? Hypoglycemia. And I know as a student, you want to run to assess because you always assess first. You assess first, yes, when you don't have enough information to perform a nursing intervention. If in the body of the question you have enough information, you're going to perform that nursing intervention, especially if it's an emergency. If it's an emergency and you choose assess, you know what you're telling the test writer? You're wasting time. If that patient had hyperglycemia, which they don't, because clearly, again, lightheadedness, shakiness, being shaky with being a diabetic, that's going to be hypoglycemia. But let's say in another world, they had hyperglycemia. You gave them a snack. That's not going to kill them because guess what? Your body has so many mechanisms to save you and buy you time when you have hyperglycemia, polyuria, polydipsia, polyphagia. But on the other hand, on the opposite end, if you have hypoglycemia, that is a medical emergency. Why? If you have hypoglycemia, that will you very fast. We don't play with hypoglycemia. Your blood sugar is supposed to be 70 to 110. Higher than 110, we could work with that. Lower than 70, you got a big problem on your hands. Okay, so the fact that we know this patient is diabetic, they got gestational diabetes, and they're exhibiting signs and symptoms of hypoglycemia, why are you wasting time checking that glucose? You could check them after you give that patient that carb, you give them that snack, because again, in another world, even if it was hyperglycemia, you wouldn't have harmed that patient. Do you see what I'm saying? So you assess, number one, when you don't have enough information to perform a nursing intervention. And number two, if it's an emergency and you have enough information, why are you wasting time? All right.